There are lots of different types of urinary incontinence. You can see there in that first picture is a normal bladder. And then the next one is where, with the prostate gland removed at the bottom. Stress incontinence is where you leak when you cough, sneeze, laugh, exert any intra-abdominal pressure. And that is really comes to fore following prostate surgery. The urge incontinence, saying overactive bladder, that is where the bladder just doesn't really behave normally. It's essential that the patient actually looks at the fluids that they're drinking. And I'm sure many men who've had the prostate cancer surgery have said that it's been quite stressed that they've, avoid caffeine, alcohol, fizzy drinks, things like that, because that then interrupts with the bladder lining, and it just makes that bladder squeeze, I suppose, if you want to put it that way, from a plain point of view, when you don't really want your bladder to be trying to squeeze the urine out. So there also helps when you do the pelvic floor to help close off that urethra and keep that urine in the bladder. However, there is that overflow incontinence, and we generally see those in patients who have got blocked urethra, whether that's a stricture or whether it's because they've had chronic sort of urinary retention over years that they haven't really been aware of. And that's normally caused by just basically an enlarged prostate. And we call that really sort of bladder outflow obstruction. And that's just where the bladder just simply can't hold anymore, and it just starts leaking out as an incontinence there.